Today I want to talk about the coming revolution in healthcare. As you know, if you've seen any of these videos, I'm big on diabetes prevention. And the atmosphere in the medical field is changing. The dietary guidelines that the CDC and the FDA and everybody is endorsing is being changed. It's going to change big time. We can't continue to live with the situation that we have now with diabetes out of control and the advice that we're getting from our physicians. And we invite you to become part of the solution and part of this new wave of medical thinking. And it's becoming more mainstream than I had ever thought. And I invite you to go to my website, www.cardwatchersutah.com, and sign up for our newsletter. I have hit the gold mine of gold mines of doctors and the new wave of medical professionals that are endorsing the ketogenic diet and exercise program, which is the one that we truly need to be on. And the information that you're going to garner from this website and from these newsletters is going to change your thinking beyond anything you ever envisioned. Everything that we've ever learned about the way to eat has probably been wrong. I know that after my heart attack, the things that they had me doing was contributing to more problems for me. And I'm doing this because I have had a heart attack. And luckily, I haven't had any surgery or stents. And it was just a stroke of luck that that didn't happen. And I have type 2 diabetes. And after looking into it, I found out I've had it for a long time. And it went undiagnosed. And I have some severe neuropathy problems. And I want to end it. I just want to stop it. It's totally preventable. Why don't we do that? So I go to this website, sign up for that newsletter, and watch what happens in the next little while. But there was a little article I read in the paper the other day. We're going to make the FDA change their guidelines, and they're looking at them right now. There's just so much big money involved in this. We need to get somebody like Jason Chaffetz in the middle of this, and maybe we can. Because for years, it's cost thousands and millions of lives, and the pain and suffering, the dollars, it's just ridiculous what's going on out there. And we now have a chance to change it. We're not going to have a chance. It has to happen. We can't. I mean, when is your health care premium more than your house payment? You know, and it's only going up. We had a 20% increase on Medicare this year and got a $2 a month raise. You know, and you can expect, you know, anywhere from, I've heard from 6 to 40% increase in your premium. If you work for a big company, you probably pay $400 to $600 a month, and your employer pays anywhere from $7,000 to $1,000 a month. And you add those two things together, wow, are we looking at some numbers? It's just something that we can't live with. We shouldn't live with. We know what's causing all this stuff, and it's time to put an end to it. It's time to get all the big money concerns out of it and do it. So please tune into that. Tune into my website. Watch for the new things that will come in the newsletter that you'll get each week, and join in the fun, because this is going to be a great occasion. Let's end it. Let's stop the pain right now. Don't pass this on down to your kids, your grandkids, your great-grandkids. Let's end it now. want to thank you for tuning in, and we'll see you next week. Thank you so much.